And then we have the palmaris, so going up like this. So that's the one that sticks out. Like I said, it doesn't go underneath the carpal tunnel. So you're going to feel that tendon sticking out like that. Palmaris. And then there's this little palmaris brevis is just part of the hypopelvic area. Okay, so then we have the different extensor ones that go to the fingers. You have the one that goes to the middle finger, or to the index finger, which is going to be extensor images. So that's going to be here. So that, remember, that muscle kind of comes over from the ulnar side and kind of goes across. And then you have all the other extensor digitorum. So you have this, sometimes it's kind of still part of the extensor digitorum, but if you have a separate tendon that goes to the little finger, it's called extensor digiti minimi. Yeah, I think there's a variation. I think it's most of the time you're going to have it, but there's different variations with some of the tendons here, where they kind of go crisscross and some sort of mix and blend with each other. So then we get into the flexor carpi ones. Right, so how many flexor carpi are on the, how many flexor carpi are there? There's 2 on the flexor side, there's 3 on the extensor side. So then, look like this. So here we're talking about tendons that don't go all the way into the fingers. They're going into the base of the metacarpal. So this one's going to be flexor carpi radialis is going to be on this side here, so you can pull back like that and you can feel that tendon that goes into here. What it does is it goes into the second and a little bit into the third metacarpal. So that's going to be this tendon right here. Okay, so then what are we going to have on this side?
On the anterior side?
Yeah. Flexor. So it's a flexor and it goes to what? It goes to the carpal, actually the metacarpal. And then it's on the ulnar side, it's a flexor carpi ulnaris, so that's this tendon right here. Okay, and then right on the other side of that goes the other way is going to be extensor carpi ulnaris. So then we have 3 of the extensor carpi, right? So you have 2 of the radialis longus and brevis. So one goes to the head of the second, the base of the second, one goes to the base of the third. Right? And then they're on the radial side, so it's extensor carpi radialis longus goes, I think, to the second, right? And then brevis goes to the third. Yeah. So longus goes to the second, brevis goes to the third. So those are going to be these tendons up here. Okay. And so then we talked about extensor carpi ulnaris. That's going to be this one right here. But so it doesn't go all the way to the fingers. It goes right there to the base of the 5th rib. So then pronator teres is going to be. This is going to be the action of the pronator teres. So if you're going to test that muscle, you're going to try to turn that way. And so then you can feel that. If you trace it across here, be that one right there. Okay. Let's do it on this side. So that muscle right there. So it's kind of underneath. So
Yeah.
Actually feel this way. Okay. So it's trying to pull this way. Okay. And then you have the pronator quadratus over here. So that pulls this one up here. And then like I said, the median nerve can be impinged by that pronator teres. So that's one of the, there's a test, a pronator syndrome test, where you do that, where you try to have the patient try to pronate, and you resist that, and then you extend the elbow at the same time. So what that does is contracting the muscle, and if there's impingement of that nerve, it's going to impinge that nerve, and then they'll get the numbness and tingling down into here. So then, usually they show this supine, but here, this is going to be the action of the biceps here. Or also the biceps is going to flex at the shoulder, but it's not the primary action at that point too. And then it's also going to do supination. So actually this one here. So you're going to try to show your palm up. I'm going to try to take it down. So this way. Okay. So he's trying to supinate like that, and then you can feel that's where that biceps is going to activate there. And then you also have the supinator muscle that comes around from the backside here. It's going like that. They're pulling it this way. So what they're doing there to test the supinator is that you're shortening the biceps like that. And so then supination is going to be this. So you're going to try to put it this way. Try to put it in. Yeah. Or hold this way.
You're actually forcing the supination. So I'd have to go this way from this angle.
So this is supination. So supination is like this. I'm going to try to do that. I'm going to try to do this. There you go. So you're trying to hold the thumb out. So this is supination. So you try to push this way and try to go back. When in doubt, always go back to the anatomical